Imagine a world where surgeons don't need to be physically present in the operating room to save lives. What if I told you that robotic hands could perform surgeries with precision beyond human limits? Sounds like science fiction? Well, welcome to the future. For decades, surgeons have relied on traditional techniques, both open and laparoscopic. While laparoscopy offered smaller incision, it presented its own challenges. Limited movement, difficulty with fine sutures, awkward surgeon positioning, and 2D vision. But robotic surgery is changing the game. The journey of robotic surgery began in 1985 with the PUMA 560 performing a brain biopsy. Then came the Robotic, assisting in hip replacements. In 1992, computer motion developed the SFOP, that is automated endoscopic system for optimal positioning, which mounted the endoscopic camera on a single robotic arm, allowing the surgeon to control it remotely via voice command. The system was widely used in cholecystectomy and hernia surgery, and for harvesting the mammary conduit in coronary artery bypass surgery. A landmark moment arrived in 2001 with the first transatlantic robotic surgery, a surgeon in New York operating on a patient in Paris. But the true revolution came with the Da Vinci Surgical System, which took robotic surgery to new heights. This system offers 3D high definition vision, EndoWrist instruments with incredible dexterity, tremor reduction, motion scaling, and improved ergonomics for the surgeon. Simultaneously, there was also rise of new technology in lenses, cameras, and computer softwares. Now, modern robotic camera systems offer 3D definition in imaging, providing stereoscopic vision with true depth perception that enhances the visualization of tissue planes and key structures. Da Vinci system has three key components. Number one, patient cart. It houses robotic arm and surgical instrument. Second, surgeon's console or master console, where the surgeon sits comfortably and controls the robotic arms with enhanced magnification. Third one is vision cart. It provides high definition 3D imaging. So this is a master console, the command center where the magic begins. The surgeon sits comfortably here outside the sterile field, comfortably controlling the EndoWrist instruments at the surgical site using these master controllers and foot pedals. The console's stereo viewer provides a three-dimensional immersive view translating real-time images from endoscope directly in front of the surgeon's eyes. It's like being inside the patient's body, seeing right every detail in high definition. The beauty lies in its natural alignment. The instrument tips appear to align perfectly with surgeon's hand in the stereo viewer, simulating the eye-hand coordination of open surgery. This gives the precision of a robot but the fineness of human touch. With the advanced features like motion scaling and tremor reduction, even the slightest hand tremors is eliminated. This provides unparalleled stability and accuracy during surgery. The console also offers a display mode allowing the surgeon to view the alongside other important images like radiological scans all on the same screen. It's like having multiple eyes on the surgery. Now meet the patient cart, the muscle of this robotic system. It's the slave unit supporting the instrument arms and camera arm. But don't be fooled, it's not ordinary cart. It uses remote center technology, a fixed point around which the arms move, exerting minimal force on patient's body wall. This enables delicate maneuvering inside the body without causing any trauma. An assistant surgeon operates the patient cart, exchanging the instrument and endoscopes, ensuring smooth transition during surgery. And for safety, their actions always take precedence over the surgeon console operator. Let's talk about the marvelous EndoWrist instruments designed to mimic the human hand. They offer 7 degrees of freedom and 90 degrees of articulation, allowing the most precise suturing, dissection, and tissue manipulation you can imagine. Compared to conventional laparoscopic instruments that offer only 5 degrees of freedom, the EndoWrist dexterity is unmatched. It's like giving the surgeon an extra set of superhuman hand. Finally, the vision card, the eye and the brain of this system. It houses the image processing equipment and comes in two variants. Standard definition, that is the SD, and high definition, that is HD vision system. Currently, robotic surgical systems are categorized based on their functionality. Daily operated system, that is the master slave like Da Vinci. This may be via on-site connection or remotely through the internet or other digital channel. Hence the publicity of operating on a patient from another country. Such remote operations are currently rarely performed, but their existence is already established. Second is the semi-automated AI-driven system. Active or semi-active system, these are typically image-guided or pre-programmed. In active system, a surgical robot completes a pre-programmed surgical task. This is guided by preoperative imaging and a real-time anatomical constraint and works through the application of inbuilt navigation system. In semi-active system, the robotic device may be in part pre-programmed and in part surgeon-driven. Third one is haptic feedback robots. Provide tactile sensation to the surgeon. Now let's see why we should embrace robotic surgery. Let's weigh the pros and cons. First, advantages. Great precision and accuracy. Reduced blood loss and shorter hospital stay, more rapid patient recovery, and reduced pain. It also has ergonomic advantages for the surgeon, so less physical strain on surgeon. Remote surgery possibility and three-dimensional views. These are the best advantages. Now coming to the disadvantages, high cost, steep learning curve, and absence of tactile feedback and long setup time. These are the major disadvantages. Another consideration is the increased operating time and overall learning curve requirement when establishing a robotic surgical program. Robotic surgery is transforming various specialties. Robotic gastrointestinal surgery, for example, cholecystectomy, Haller's myotomy, liver resections, pancreatectomies. In robotic colorectal surgery, better visualization and ease of working in limited space, for example, in the pelvis. In thoracic surgery, usefulness in the thymectomy where the access is very difficult. In cardiac surgery, robots have successfully used in minimally invasive mitral valve repair and replacement, cardiac septums, and bypasses. In urology, it is the gold standard for prostatectomy, pyeloplasty, nephrectomy, cystectomy. In neurosurgery, precision-driven brain tumor removal, whereas in orthopedic surgery, joint replacement with robotic assessment, and in bariatric surgery. To understand the comparison of laparoscopy and robotics, today we compare two titans of modern surgery, conventional laparoscopic surgery versus robot-assisted surgery. Representing the well-established technique of laparoscopy is surgeon Dr. Arif, who is a laparoscopic surgeon known for his precision and expertise. On the other hand, we have surgeon Dr. Hussain, showcases the latest in robotic technology, redefining the surgical boundaries. While conventional laparoscopic surgery, a well-established champion known for its affordability, proven efficacy, and adaptability in large spaces like peritoneal cavity, it's been around for decades, refined for perfection, and it's affordable, ubiquitous, ensuring accessibility worldwide. With proven efficacy, it consistently delivers excellent outcomes across a wide range of procedures. Laparoscopic surgeries appreciates the ease of working in large spaces like peritoneal cavity, allowing flexibility in maneuvering instruments. Additionally, laparoscopic procedures can be performed with a less experienced assistance, ensuring operational efficiency even in resource-limited setting. Now coming to robot-assisted surgery, it brings a new level of precision and control. With 3D visualization using a dual-camera photo system, it provides a high-definition magnified view of surgical field. This enhanced vision translates to improved dexterity with instruments simulating natural fingers and wrist motion, offering unparalleled maneuverability. It eliminates physiological tremors, enhanced dexterity, and offers motion scaling for ultimate precision. While laparoscopy relies on the surgeon's hand, robotic surgery relies on computer-assisted navigation, making complex procedure feels like a video game. Precise, controlled, and immersive. The learning curve for robotic surgery is notably shorter, making it easier for new surgeons to master complex techniques. Unlike laparoscopy, robotic system eliminates the fulcrum effect with jointed multi-articulate instruments, allowing intuitive movements. They also offer 7 degrees of freedom, mirroring the natural range of motion of human wrist, ideal for delicate suturing and dissection. The ability to scale motion gives surgeon precise control, with even the smallest hand movement translate into meticulous instrument actions. The ergonomics design allow the surgeon to sit comfortably on the console, reducing the physical stress and fatigue, while surgical isolation from the external distraction enhances the concentration. One of the most revolutionary features is the telesurgical ability, enabling remote operations by transmitting instruction from the console to a robotic system miles away. This technology bridges the distance, paving the way for global surgical collaboration. Robotic systems also excel in precision with microanastomosis, allowing complex vascular and nerve repair that require high magnification and dexterity. Now, honestly, see the disadvantages of conventional laparoscopic surgery. Despite its widespread use, conventional laparoscopic surgery has its limitations. Surgeons experience a loss of touch sensation, rely solely on visual feedback, the absence of 3D visualization, step perception, making spatial judgment challenging. The learning curve is longer as surgeons must master counterintuitive hand movement while maintaining compromised dexterity. Limited degree of freedom restricts movement, maneuverability, particularly in confined spaces like pelvis. The fulcrum effect, where hand movements are mirrored oppositely on a skin, adds to the complexity. Physiologic tremors are amplified, demanding exceptional hand stability for precision work. But yes, robotic assisted surgery do have disadvantages. While technologically advanced, it is not without challenges. The absence of touch sensation persists, leaving surgeons to rely exclusively on visual cues. A highly skilled assistant is required at the patient side to support the procedure, adding the team's complexity. If the patient's position needs adjustment, the robotic system requires redocking, increasing the setup time. The high setup cost is a significant barrier, with robotic system costing over $1 million, impacting affordability and accessibility. Being a new technology, the long-term benefits remain unproven, raising questions about cost effectiveness. Operating room setup takes longer, and the procedure duration can also increase due to complexity of the equipment. The bulky nature of robotic system occupies significant space in operating room, necessitating careful logistic planning. So who wins this battle? It's not about the better or worse, it's about right tool for the right patient and surgeon. Laparoscopy remains a trusted warrior for routine procedure, while robotic surgery is a futuristic knight for complex cases which demand precision. Despite these challenges, the advantages are undeniable and the technology is constantly evolving. However, many issues are still not resolved, such as the clinical feasibility and safety of the robotic surgery in a general surgical context, and length and difficulty of the learning curve, the clinical application and drawbacks. So, what does the future hold? We are moving towards. The disadvantage is reduced awareness of non-verbal communication, thus highlighting the importance of team training, and regular verbal cues. Motion compensation, although not commonplace in current clinical practice, robotic surgical system may in future provide motion compensation to facilitate surgery on a moving target. Example where this may be beneficial are the beating heart cardiac surgery, such as coronary artery bypass, grafting, and mitral valve repair. In this setting, the increased dexterity of the robotic surgery combined with removing the need for cardioplegia and cross clamping may be particularly beneficial in terms of reducing the post-operative inflammatory response and improving its associated morbidity. If we look at the future developments, there is a long delay between the idea and commercialization of the product, and robotic surgery is only in its infancy. Several fascinating new developments may change how we use the robotics in the near future. Miniaturizing of robotic technology appears to be the theme of new generation of the devices. Robots that are smaller than current system have a natural advantage because they are easier to deploy and can be used in more settings. The University of Washington group has developed a smaller prototype machine that has capability of being mounted on patient and controlled remotely. This robot named Raven has been prototyped and tested in the field. Due to its smaller size and adapted enhancement, it can be deployed in the remote areas and teleoperated. Other robotic technologies allow the surgeon to make rounds while sitting in a remote location. This device, developed by Dr. Yulin Yang, is called RP7 and is mobile robotic platform that enables the physician to be present remotely present by controlling the robot movements via the internet. Robotics provide a unique possibility of separating the surgeon from the patient. This separation can be measured in feet or in thousands of miles. Telesurgery, along with the telemonitoring, has been tested in several environments and has shown to be feasible and beneficial. The removal of a gallbladder across the Atlantic Ocean and the mentoring of surgeons in Canada are examples of how technology is rapidly approaching the day when any surgeon can be connected to a number of colleagues who may be able to consult and in some cases assist during complex surgical procedures. Natural orifice transluminal endoscopic surgery, that is NOTES, is a new approach to abdominal surgery that promises the future reduce invasiveness by assessing the peritoneal cavity from a natural orifice. Miniaturizing of robotic tools and the ability to place robots entirely inside the peritoneal cavity offers significant benefits in natural orifice procedures. Once inserted, the robots can be used inside the peritoneum without the typical constraints of an externally actuated flexible endoscopic device. It can be positioned to provide visualization and tissue manipulation within each quadrant of a peritoneal cavity. Sounds crazy, right? Multiple miniature robots can be placed inside the peritoneal cavity with the number of devices not limited by the small diameter of the natural orifice. Such robots equipped with the stereoscopic imaging could provide much needed depth perception for the surgeon and could allow triangulation between the image plane and the motion of the tools. The feasibility of using in vivo mobile robots for nodes procedure has been successfully demonstrated in a porcine model. New technologies are sure to follow along, and this field will not look same in 10 to 15 years. It can be expected that we will continue to move towards more automation, more computer interface, and more mechanical assist, and further away from the open surgical techniques that were pioneered in the years before. Robotic surgery is not the future, it's happening now. It's about empowering surgeons with the tools they need to provide the best possible patient care. In future, we expect AI-driven robotic assistant, self-learning robots with decision-making capabilities, telesurgery advancement, surgeons operating from different continents, nano-robots where microscopic robots performing surgeries inside the blood vessels. As surgeon, embracing technology is the key to better patient care. Want to stay ahead in your career? Like, comment and subscribe for more high-value surgical education. Follow me on Instagram handle for exclusive insight. Don't get left behind. The future of the surgery is already here. Thanks for watching this video.